Is your time on your Friday morning, and the start of the school year means that a number of sports will soon kick into high gear if they haven't already. From the high school level to the professional ranks, athletes of all ages are susceptible to concussion risks. But the treatment plan depends on the person's age. Dr. Aaron Karlin, the director of the Ochsner Concussion Management Program, joining us now to explain some of the different ways to treat concussions. Welcome to you.
Thank you very much for having me.
All right, well, for some people who may not know what a concussion is,
sure.
What is a concussion?
Well, concussion is a type of traumatic brain injury, actually. So the analogy that I use frequently, it's an injury to the wiring of the brain. If you think about that old-time telephone switchboard operator, the kind that's going to put the pegs in to connect the different phone calls, the idea is someone came to that switchboard with a baseball bat and hit it. And those pegs get knocked out, and however long it takes that operator to put those pegs back in, put them in the right holes, and to have them stay, is kind of the basic idea of how long it takes for that concussion to get better.
Well, boy, and when you put them in that kind of term, it really brings it home, because you think about just how dangerous concussions can be. In the past, people would talk about perhaps, you know, just kind of getting a little bit of a stinger or your bell rung. That's out the window, apparently.
Oh, absolutely. So a couple of things have changed. We know that you don't have to be knocked out to get a concussion. In fact, less than 20% of concussions are associated with loss of consciousness. And that term that you talked about, getting your bell rung, we try not to use that. Those are the folks that have symptoms that might last only 24 hours or even less, 3 or 4 hours, and they're truly resolved. We found out that that brain is actually abnormal for close to a week, despite them feeling back to their baseline. The neurometabolism of the brain, the way that it makes decisions, sends signals to the body, is actually abnormal for close to a week.
Yeah. Doctor, how do we know if somebody is suffering from concussion-like symptoms?
Well, there are 4 main symptom groups that we look at when we're talking about someone potentially having had a concussion. If you think about those pegs in that switchboard, you can put them into 4 categories. First are physical signs and symptoms: headaches, nausea, vomiting, lightheadedness, light hurting your eyes, sound hurting your head, vision changes. Thinking changes. Cognitive is the next group. Trouble with memory, trouble with word finding, slowed reaction time, slowed processing speed, things like that. And then the other 2 that are oftentimes overlooked is sleep disruption. Folks who are normally good sleepers all of a sudden having trouble falling asleep or waking up through the night or tired throughout the day, taking extra naps. And then the one that's overlooked the most, especially in kids, is emotional lability. Kids who are normally pretty even keel, up and down, happy, sad, more irritable, snapping at people, or withdrawn and flat. Those are the things that you're looking for.
As kids participate in sports, whether it be football, soccer, anything in which, you know, head injuries are possible, what do you tell parents? You know, how do we protect our kids?
Well, it's hard to, there's a number of ways that you can try to prevent a concussion, but whenever you're doing a contact or collision sport, that child is going to be at risk. Technique is really the most important thing. For example, in football, proper tackling is incredibly important, keeping your head up. Other types of having well-fitting equipment. One thing that I get frequently is, what's the best helmet for my kiddo playing football? Or should my soccer playing youth wear a helmet or one of those headgear, headbands? And the unfortunate answer to that is there isn't one particular helmet that's going to protect you. If you take another analogy that I use, if you take a raw egg and you shake it hard enough, you can break that yolk inside. And that's more the idea with a concussion. It's a banging in a way of that brain inside the cranium. So technique is really the most important thing, and practice makes perfect there.
Yeah, and we're learning more and more about, I guess, some of the long-range implications of repeated concussions. And it's pretty scary when you think about it.
Yeah, absolutely. You know, most of the research seems to show that 3 is almost the magic number. Once you get past 3 concussions, it tends to be that you have a lower threshold to have subsequent concussions. And one of the things that we actually look at is once our athletes coming through our concussion clinic, for example, get to that point, we have to look at the duration of symptoms that they're having with subsequent concussions, the frequency, the time in between, the severity of their symptoms, and sometimes actually have conversations about retirement from contact or collision sports. Another great study looked at collegiate athletes with 3 or more concussions, and they actually had statistically significantly lower GPAs than those who didn't. That's scary.
It is, but we certainly appreciate all of the advice and all the information ahead of what will likely be a very busy sports season. Lots of things to keep in mind.